Hello and welcome to today's webinar, Updates for High Power Laser Therapy and Financial Success. This webinar is presented by Zimmer MedizinSystems. I'm Regina West and I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. Following today's presentation, we will cover those questions live. If there's not enough time remaining for all of the questions, answers will be emailed to you. And now I'd like to introduce the speaker for today's webinar. We have Dr. Farley D. Brown standing by. Let's bring him on camera now. Dr. Brown, would you please join us? Hi, Dr. Brown. Is your mic enabled?
Ready to go, all green here, thank you.
Excellent. So now I'd like to give a little bit of background on Dr. Brown before he begins his presentation. Dr. Farley Brown earned his doctorate in chiropractic medicine with an emphasis in clinical orthopedics, therapeutic exercise, and pain management from the Southern California University of Health Sciences in Los Angeles, formerly known as LA College of Chiropractic. After practicing chiropractic and physical therapy for more than 2 decades, Dr. Brown became a clinical education manager and product development consultant for several corporations, most notably a 10-year stint with DJO Global in Vista, California. Dr. Brown has presented in over 50 countries and is sought after across the globe as a keynote speaker on rehabilitative sciences topics. Dr. Brown is also a recognized international expert on clinical modalities such as laser, shockwave therapy, decompression, and electrotherapy. And if you're just joining us now, I've just introduced Dr. Farley Brown, the speaker of today's webinar on updates for high power laser therapy and financial success. Welcome again, everyone. Welcome. Thank you for joining us again, Dr. Brown.
My pleasure.
I'm going to hand over the webinar to you now, and in a moment we should be able to see your screen and your presentation.
Well, thank you for joining in today. So our topic today is therapeutic usage of photobiomodulation, and we'll try to clarify that word as well. And what do we really call this therapy? There are so many synonyms in today's market: cold laser, low-level laser, soft laser, laser light. What it really comes down to is light energy, but it's photobiomodulation we are administering. It's an ionizing optical radiation in the visible and near infrared range. It's a therapy we elicit, photophysical, photochemical, to positively influence biological processes on our patients. And done correctly, we can do it without eliciting thermal damage. By classification, any laser over 500 milliwatts is our class 4 or our high power laser, what we're going to be speaking to today, like the OptonPro. Traditionally, I know a lot of clinicians have been using 3Bs. I did for years myself, but technology has given way to these class 4 lasers. My own personal introduction to lasers goes back as 1994. As an aspiring chiropractor, I was looking for a niche, something to give me better outcomes. I had a practice across the street from a beautiful country club where there were golfers. And invariably, many medial epicondylitis or golfer's elbows came through my door. And the traditional cross-friction massage, taping, ultrasound, it was a 50-50 bag getting these guys better. But one day, a salesman walked in with what looked like a flashlight. And I still have this laser. One diode, 100 milliwatts, and he said, try it for a couple weeks. I said, you know what, just try it. Well, I did 3 times a week on each one of these patients for 2 weeks, and the outcomes were unbelievable, like nothing I'd ever seen before. That caught my interest, and I delved into light energy and lasers. I adopted 3Bs and made the transition into class 4s. So I am a believer, and I hope you will be too. Laser, by definition, light amplification by stimulated emission of radiation. So laser actually has a meaning, that acronym. And again, it's artificial electromagnetic radiation, not enough radiation to cause a genetic mutation or something that could harm our patients. Light energy for healing. Einstein experimented, played with it, but no, it wasn't him who came up with the philosophy, the technique, and the technology. There was a professor out of Budapest, 1964, Dr. Mester, who was trying to destroy tumors with low-level lasers. Well, he wasn't getting a decrease in the size, but he noticed surrounding tissue responded incredibly favorable to this light energy. So he switched his whole agenda to experimental skin defects, diabetic lesions, venous ulcers, and the troublesome hospital bed sore. This is the gentleman who put low-level lasers on the map in physical medicine modalities. For our discussion today, let's lay down just a little terminology. The power in our lasers will be expressed in watts. Our energy will be expressed in joules over centimeters squared. Dosage is joules times time, and our wavelengths will always be expressed in nanometers. With most lasers on the market, you can vary a couple of these parameters. But with the OptonPro, which is our focus for today's conversation, you can control all of these parameters for your clinical needs. Comparing high power to low power, or class 4 to 3B, what is it essential to know? Well, with high power, there is shorter periods of treating time because we're delivering so much more energy. Depth of penetration. It seems to reason, the more power you have, the better opportunity for penetration and energy we'll have. Thermal effect, probably the biggest knock we've had to subject ourselves as clinicians all these years was with the 3B not being felt. Patients just didn't really believe it because they didn't feel anything. You won't have that with a class 4 laser. There is a very soothing analgesic heat that's produced, something you need to be conscious of too. Both therapies do require eye protection at all time because the damage is irreparable. And as a side note, with class 3B and class 4, going over body ink, tattoos, is something to be aware of. The ink draws it in like a magnet. So just be aware of that, whether you're using 3B or you're adopting to a high power. Let's take an example of how much quicker in a therapy session it is. If we're going to disperse 4 joules of energy in this example, 4 joules over centimeters squared in a low-level laser at 200 milliwatts, that's going to take us 20 seconds. That doesn't seem like a whole lot of time, 20 seconds to administer 4 joules. But if we make the jump to a high power, 1,000 milliwatts, that same 4 joules can be delivered in 4 seconds, 16 seconds. At the end of the day, adding up on that could be the difference between a patient or two. Just to give you an example of how much more efficient and faster energy is delivered with a high power laser. I always like to understand and explain how these work. So for 30 seconds, we have to go back to that painful inorganic chemistry to have an understanding when you plug the socket in on one of these lasers, How is that electrical energy converted into chemical energy? Well, go back to the atom. The atom has electrons spinning in shells around it. They go from a lower energy to a higher energy. And when they get to that higher energy, they are spun off. As that electron spins off, it now becomes a light photon. And the light photon is what we use to deliver into the body to get these physiological changes. If you looked at this diode, this is a rudimentary picture of a diode. And the difference with high power and low power is a high energy driver. So as that electron enters, it's going to strike mirrors, posterior and anterior, that causes it to bounce and gain speed in the amplifying medium and exit as a photon. We're now ready to treat the patient. The photon enters the body via chromophores. Chromophores are all over our body, all anatomical areas. And as the light into the tissue, the photons will scatter, reflect, and hopefully be absorbed. Absorption takes place in the melanin, the hemoglobin, the oxyhemoglobin, and within the water. How does this cascade work then? How do we get the desired effect? Well, if we take that photon and apply it to the tissue, again, it enters the chromophore into the mitochondria, the powerhouse of the cell, which in turn activates the cytokine oxidase respiratory chain. We're getting a tremendous increase in ATP synthesis. The photon energy now is converted to chemical energy. And make no mistake about it, this is how lasers work, by increasing ATP synthesis, giving cells energy to heal, fight off infection. We get an increased ATP synthesis, we get an increase in circulation, artificial cytokines, cell membrane permeability is increased, protein synthesis, and the replacement of cells with cell proliferation. And if we do everything right, we're going to get repaired tissue and decreased pain. This is the cascade of how lasers work on our patients. This looks like a busy slide, but it's not. Most clinicians who still adopt between lasers and ultrasounds, after seeing this slide, never go back to an ultrasound, because this shows you exactly what lasers are capable of. Angiogenesis, neovascularization, creating minute networks of blood supply, oxygenating, giving you microcirculation, realignment of collagen, collagen necessary for healing, retardation of muscle atrophy and degeneration by repairing fibers and activating myogenic satellite cells. Few modalities have a better effect on inflammation and edema than lasers. They have the ability to spike that inflammatory cascade and kick it into gear past inflammation and into a proliferative stage of healing and onto remodeling. Neurologically, there's a few applications. When we're talking about nerve root compression in the spine, it could be cervical, it could be lumbar, thoracic, we can activate the action potential firing and stimulate it with light energy. Cartilaginous production, increasing in chondrocytes. This is why lasers work so good in osteoarthritic joints on our senior populations, knees, shoulders, elbows. Anywhere osteoarthritis can present, we can stimulate chondrocyte production, and it gives a soothing effect. And one of only a few modalities I know that you can use on non-displaced microfractures successfully. getting osteoclastic activity. So many usages with light energy. And again, all predicated on ATP production, giving the cells energy. Couple of the biggest usages, wound healing, for instance. ATP production, again, increasing the cell's ability to fight infection. Reactive oxygen species, directly impacting going through the mitochondria, helping repair and healing. And a positive release of nitric oxide. Nitric oxide, which increases circulation, decreases inflammation, and transport oxygen to immune cells. Lasers work fantastically around peripheral parameters of wounds. But what about pain? I still contest, if you can get to a patient within the first 48 hours of an acute injury with a laser, you'll cut the treatment times in half. Why? Lasers have the ability to increase endorphins, get that endorphin release, release serotonin in the central nervous system. More nitric oxide transporting, oxygenating, and we can get a depolarization and an inhibition of C fibers. So it works fantastic as an analgesic and pain relief modality. Going back to that neurological implication, again, stimulating action potential. No, a laser isn't going to be able to take care of a disconnection, a sheath loss, but again, on nerve root compression, very effective, tracing the root back and treating it there appropriately. So what are we going to use it on? Well, tissue healing, open wounds, diabetic lesions, soft tissue injuries, sprains and strains, repetitive work traumas, carpal tunnel, tenosynovitises, hematomas, non-displaced or microfractures, and again, in pain control, radicular pain, referred, acute and chronic instead of a drug, and muscle, ligaments, and tendon tears, areas that don't have a lot of vascularity. But what about those problematic conditions? Reflex sympathetic dystrophy. If you've ever treated one of these patients, you can sympathize how difficult they are to treat using desensitization techniques and just trying to palpate the patient. But they do respond favorably to laser in my own personal experiences. Fibromyalgia, also difficult patients, multiple trigger points, satellite cells. TMJ, dentists, oral surgeons have found plenty of usages with this. And again, osteoarthritis, difficult, long-lasting osteoarthritis respond very well to light energy. And then there's our category of neuropathies again. Diabetic patients will have pain 50% of the time. Half of them, pain somewhere in their body that they can perceive. That's not even to mention what they can't perceive due to sensation deficits. But unlike medication, this therapy, as we've just learned, accelerates blood flow, release of nitric oxide, and can positively influence cellular activity for diabetic patients. Here's an example with diabetic neuropathy. Diabetic neuropathy affecting the low back and the lower limbs. So you're having low back pain, which is actually the origin, and it's affecting the lower leg, which subsequently affects gait. They complain of pain, tingling in their feet. I can't feel my feet, they walk. A nice little protocol treating from L2 to S2 and effectively treating the popliteal Achilles insertion. 10 joules over centimeter squared over both areas, averaging 15 watts, and that's a 13-minute combined therapy for both areas. and there's some significant relief for a diabetic neuropathy. What about our contraindications? Like all electrical modalities, any history of cancer, space-occupying lesion, we shouldn't administer a laser. Again, irradiation over the eyes, eye protection is essential. 1 out of 30 patients will be photophobic. They'll break out into a rash, get irritated. They're not a candidate for laser therapy. If a woman is pregnant, like always, we avoid the low back and abdomen. And the one big area, the carotid sinus. We avoid the carotid sinus area or the carotid triangle. That sinus in there, as we know, can speed the heart up or slow it down. So just as a manner of good practice, we avoid the carotid triangle. Which takes us to, let's understand a little bit more about the hardware. Power. Power is going to be expressed in watts, as we know, and it will be preset in the device and hopefully have the ability to be adjusted like the Opton. 0 to 25 watts continuous. You pick the power you want. And the greater the power, the more photons will be delivered to the lesion site. If you look at a 3B, very shallow. But if you look at the class 4, safe, efficient, and up to 5 centimeters of penetration. Again, power is what's going to get it to the lesion site. Wavelengths. Again, it's going to be measured in nanometers. And somewhere between 810 and 980 is the optimal rehabilitative soft tissue penetrating wavelengths. It also has the ability to release nitric oxide, stimulate microcirculation, but that is the sweet spot for soft tissue penetration, 810 to 980. When we talk about wavelengths, again, with our OptonPro, we have 3, the 810, the 980, and the 1064. And all 3 of them have a 100% penetration at the bone joint interface. And that's where you want your absorption, at the bone joint interface. Nice and deep, up to 5 centimeters. So here's the fundamental question people love to ask me. Is it power or is it wavelength? What has the fundamental role? In reality, it is wavelength. It has the fundamental role for the therapeutic action. Power, as mentioned, determines the amount of photons what will reach the target or lesion site. But it is the wavelength that enables the penetration deeper to be delivered. If you look at this example, you have 2 20-watt probes, the 810 and the 1064, both at 20 watts. The 1064 would be more energetic because it's going deeper. You're getting deeper penetration. The longer the wavelength, the better the penetration. Power gets it there. Wavelength is what gets the absorption for you. Which leads me to a point about frequency. A lot of these devices have the ability to adjust frequency, somewhere between 0 and 20,000 hertz. Well, what does that mean? If you looked at this scale of microwaves, ultraviolet, and gammas, gammas are more reflective of like an X-ray. And we all know nothing penetrates deeper than an X-ray. Well, by increasing your frequency in a given situation where maybe you've done a couple treatments and you're not getting any desired effect, alter the frequency, speed the frequency up. And as the frequency speeds up, you'll get a better penetration. Just a little clinical tip. But this combined wavelengths in the probe is what is the game changer in these high power lasers like the OptonPro. 810 is the best all-around wavelength, as we learned, for soft tissue penetration, oxygenating, stimulating blood flow. And then the 980, this is the one that gives the heat, gives that analgesic relief, lets the patient know they're getting something, and at the same time inhibiting pain fibers and closing pain gates. The 1064 is more of an orchestra. It orchestrates between all three. It assists in the delivery of heat, but also produces biostimulation, protein synthesis, and cell metabolism proliferation. So the interesting thing is you can use these in combination together, or you can use them individually on the OptonPro, depending on what you want. So the advantage of having these combined wavelengths, it allows you to reach different targets. It allows for different timings of biological effects, vascularly, inflammatory-wise, immuno, and creating cell proliferation. That's why these are so effective as compared to the traditional 3Bs. You can't get that with a single wavelength. Because in the end, it is all about absorption. If you looked at that sponge, that's just a representation of some tissue we're treating. Each anatomical area you're treating can absorb X amount of photon. And when it's saturated, it's going to seep into adjacent areas. This is the phenomenon known as scattering. Not a bad thing. It's just a phenomenon that happens when the tissue cannot absorb any more light energy. How do the treatment techniques differ from low level to high power? If you look at the traditional low level, a playing card was our treating area, and we tried to cover every millimeter, centimeter on that playing card. And if we did everything right, we were lucky to come away with 35 to 50 joules per centimeter squared in that area. But if you look at high power now, this is truly a dynamic treatment. We're able to treat the upper part of the extremity and the lower part. That's why we keep the probe moving, and in that same amount of time that I delivered 35 to 50 joules, I'm delivering between 3,000 to 4,000 joules centimeter squared in a high power laser treatment. That's the difference. This is why people get better, why pain is arrested quickly. So how do we approach that? Trigger points. Lesion site, trigger points, and biostimulation. That's how we do a high power laser treatment. It's dynamic. Primary lesion site based on palpation, trigger point based on palpation, and then we come back through and do biostimulation to the entire area. It's a 3-part treatment that can be done in the same time as a low power, only delivering exponentially more energy to the area. The handpiece on the OptonPro makes it very easy to handle. It's got a modern shape, it's a comfortable soft material, and it's got a hand switch that you can initiate the on and off, and equipped with an infrared sensor for measurement of skin temperature. And we're going to get into that because it's the only laser on the market with this thermal safety feature. Let's talk about that. With this thermal safety feature, what does that mean? Well, you can set in Fahrenheit or Celsius a limit not to go over. Well, how does that work? If we go into the guided user interface, we click on the Opton icon. From there, we activate it. We go to Fahrenheit, unless you're in Europe and you want to go Celsius. Here we've picked 102 Fahrenheit as our limit. What that means is if the tissue temperature exceeds 102 Fahrenheit, the device is going to pause. It's going to pause until the tissue temperature drops down below that. There's your safety. You're never going to burn a patient with the OptonPro. And I can't say that for other high power lasers, but this one is foolproof. You can't because you can set your limits. What about emission modes? Well, you have continuous, which would be ideal for biostimulation or heating an area of tissue you want to stretch, get some range of motion back on. Or you could go pulsed. Pulsed would be perfect for an area that's acute. It's acute. I don't want to heat it up anymore, yet I want this light energy to get me some microcirculation and close a pain gate. And then there's single pulsed emission. Single pulsed emission can be adjusted at different durations, but ideal for trigger points, fibromyalgia. You want a very strong single pulse, not to generate heat, but go deeper into the tissue to cause your desired effect. So there's 3 different emission modes that you can choose from. And then the wavelengths, as mentioned, you can use all 3 in combination together, or I want to go with 810 for the best soft tissue penetrating ability, or I want to go 980 to heat the tissue. I want to heat it and decrease the pain. Or I want to go 1064. I want to make sure I'm going all the way deep. I'm going to get stimulate some biostimulation at the end to cover the whole area. This is how they can be used together or individually. Great feature to have for treating your patients. And there's a very unique pain management option using our VAS scale. So when the patient enters, we get a parameter. Where are you between 1 and 10? I'm at an 8.5. And when they leave for the day, we have another number, which looks like about a 6.5. Hopefully we're doing it right and it's increased at the start and decreased at the finish. But this is a way of discernibly showing your patient at the end of each treatment, the pain is decreasing because you can show it to them from start to finish. So this is a great little pre and post pain management option you can share with your patients. That was a lot of information in a relatively short time, but I would love to open this for questions you might have. So I'm going to turn it wide open, and actually, Regina,
Yes.
We're going to open. Yep, let's open it for questions. If anybody has any, I am available for questions. And then I think my colleague Gerald also has a slide to share.
Yes, thank you for that excellent presentation. It was just chock full of really interesting information. I'm just going to take the screen back here, and we'll be ready to start the Q&A portion of the webinar.
Thank you.
I just want to remind the attendees that it's not too late to submit questions. If there are any who have questions and haven't yet submitted them, please do so now or at any point during the rest of the webinar. Okay, let's get to some of these questions. The first question is, Dr. Brown, can class 4 lasers or high power lasers do any harm to the patient?
That's a good question. I mean, I always take it back to human error, and it's not the machine's fault. So in this example, good question. As we just touched on the thermal safety option on the Opton, absolutely. Having that option, though, certainly decreases the chances. Probably the number one cause of a patient's discomfort from a high power laser is probably the heat. The clinician maybe is not using the probe, moving it quick enough, or maybe it's just using too much energy. So that's the extent of the damage, Regina. But obviously, if you had that thermal safety option, it certainly would decrease the chances of that.
For sure. Okay, next question. Does HPL or high power laser therapy have a higher penetration than cold laser therapy?
I believe it does. I believe it does. And I always like to use the analogy of if you had like a pistol that fired singly, that's kind of like what a low level laser would be doing, bang, bang with the photons. On the other hand, if you had something that was fully automatic, a machine gun, you're an example of a high power laser. It's just delivering exponentially so many more photons. You cannot help but have better penetration by the sheer number of photons you're delivering.
Okay, next question. Does insurance cover the cost for laser treatment?
Unfortunately, it doesn't. But as we're seeing here in the United States now, everything really is going fee for service. The rest of the world's been dealing with this forever. But not to be discouraged. I mean, even back when I was practicing actively with my laser, I did creative things like offer treatment plans where a patient could pay upfront for 10 treatments, and if they paid for them upfront, I would discount it. And those treatments stayed with the patient. Meaning, let's say a patient bought 10 laser treatments. Well, let's say after 4, it's resolved. They don't lose those treatments. They still have them, and if a family member needed them, it's just getting creative with the finance, the economics of it. I mean, that's one way to do it, and there's even prorating them. So I guess what I'm saying is there are ways to get your return on investment successfully, utilizing a treatment plan and just charging cash for these treatments. From what I understand, the going rate for a lot of these treatments is anywhere from $50 to $100, depending on where you're practicing. So you could base a treatment plan, a treatment package of 10 treatments off of that. And let's say it's $500. Well, they could pay the $500, charge them for the $500 for the laser treatments, which are going to work. And if they paid up front, I always discounted it. Okay, you're going to pay upfront cash right now. I'll discount it 15%, and or just a number. And they just didn't lose those treatments. Those were their treatments. So I think that's a great way of combating this reimbursement that's going away.
Yeah. Okay, so I have a related question, which you did touch on, but let's see if you have anything to add. The question is, how much does a high power laser treatment cost the patient, and how much are you charging the patient per session?
So it varies, obviously, on the geographical area where you're practicing. I mean, I think some of the competitive pricing I've witnessed is anywhere from 50 up to 100 per session. Some is 80, 100. And again, your demographics are going to dictate how much you can charge for it. But I certainly wouldn't go under $50 for a treatment, because it's well worth it. It's a therapy that's going to work. So that's been my experience. 50 to 100 is the parameters for charging on these.
Right. Okay. Bunch of questions rolling in here. Years ago, the FDA identified 100 MW as a non-thermal laser and the class 4s as a heating modality. Have they reclassified these parameters that you know of?
Not that I know of, but I mean, I certainly can tell you that class 4 lasers are not considered like a heating modality. Again, you're talking about a light energy here. I mean, an ultrasound to me is a heating modality. This is far stronger than an ultrasound, a class 4. So obviously, I'm not sure that there's been a reclassification, but I could certainly find out and get back to you on that. We could find out for it. And Gerald, My colleague who handles the commercial end of it, he might be aware of that because he's been more involved with the FDA passage of getting this unit into the United States.
Yes, we will follow up with the attendee who asked that question via email. We have that information, and we'll follow up. We'll get you that information.
Perfect.
Next question: is it the wavelength that actually controls the depth of penetration?
The wavelength has the responsibility of getting better penetration. So again, let's clarify that. Power is what's going to get the photon to the lesion site through the soft tissue. But once there, getting that absorption and entry into the lesion site more efficiently will be wavelength dictated. Yes. Again, remember our example, the longer the wavelength, the better the penetration. So again, that's where the usages of a longer wavelength, if you need to go super deep, or if the area you're treating is not that deep, an 810 or 980 might be enough. But again, that's the beauty of having 3 wavelengths. Where's the anatomical area? For chiropractors, that's myself, treating backs and stuff, I want that to go as deep as I can. I want that to go as deep as I can. I would be using all 3 of those wavelengths simultaneously. So I'm not only heating, but I'm getting superficial tissue penetration. I'm getting a warming effect, a closing of pain gate, and the 1064 is getting it as deep as it can to get better penetration, at the disc region or nerve root.
And you can, on the OptonPro, you can use them all simultaneously, can't you?
Or separately. Again, that's the beauty of the way the machine is set up. You can use them simultaneously or separately.
That's great. Okay, next question. Is HPL, again, high power laser, a standalone therapy or can it be combined?
You can combine it. And probably, I love that question because I've been asked that around the world. I think the best combination in the world, hands down, shockwave and laser. That is like an unbeatable combination, whether it be a back, a shoulder, a plantar fasciitis. And you ask why? Well, here's why. The combination. You can use a laser standalone, as we realized it's going to generate ATP and give the cells energy for healing. And yes, there is a microcirculation component, but a shockwave also, the shockwave's primary function is creating new networks of blood supply. So if you're giving these cells more energy to heal, recruiting blood flow, and then you're also creating new areas, new networks of blood flow, and realigning collagen like a shock, it's an unbeatable combination. So shockwave, that's my go-to. Laser and shockwave. Okay. And which do I do first? I prefer to do laser first, shockwave second.
Okay, great information. We actually do have a question about about shockwave and high power laser therapy. For those who don't know, what is the difference between high power laser therapy and shockwave therapy?
Well, again, laser is going to be light energy. It's light energy that can produce heat. Shockwave is a mechanical wave. It's a mechanical wave, a mechanical acoustic wave that does not produce any thermal effect. Its net reaction is creating new networks of blood supply, realigning collagen, stimulating connective tissue strengthening, release of tenocytes, bringing blood flow to the area in mass amounts. So that's how they differ. One's a mechanical wave, one's purely light energy, recruiting ATP as its mechanism for healing.
Okay, thank you for that clarification. I have 2 questions here that are protocol related, so I will combine them into one question.
Okay.
Frequency of treatment recommendations, and how long does a typical laser treatment take? So frequency and duration.
Well, your frequency is going to be dictated by really the body part you're treating. As we talked about earlier or in the presentation, frequency is really going to be dictated off of, am I getting the desired effect? Usually on the machine, if you hit the body part in our indication, it's going to give you a frequency. That frequency is given to you through the software in the device. Okay. Now, that being said, though, if after the second or third treatment, you're not noticing any discernible change, then I encourage you to increase the frequency and make it go faster. But getting back to the duration, a high power laser treatment is six to 7 minutes maximum. Okay. Now, the example we showed at 13 was like 6 minutes in each region. So again, 6 or 7 minutes total, and you're going to deliver between 4,000 to 5,000 joules per centimeter squared of energy.
Okay, thank you. Next question, can this laser be used for aesthetic treatments and procedures?
No. Our laser is predominantly musculoskeletal, and that's based on the wavelengths. Wavelengths that are better for aesthetics are much shorter wavelengths, 600, 440, wavelengths like that. Our focus is musculoskeletal, so that's what our lasers do.
Okay. Actually, the attendee who had asked the previous question about frequency, he sent in a clarification here. By frequency, he meant how many times a week would the treatment be?
Frequency times a week. Yeah, you can do high power laser every day.
Oh, wonderful. Okay. But the other information about the other type of frequency was very good too. Thank you. Okay.
Yeah, they can do it every day. Every day you can use laser.
Good. And what are you said that it's for musculoskeletal, but what are the best indications for high power laser therapy?
Sprains, strains, any acute inflammation. I mean, that's where it's got its best value. If you had a wound and you wanted to go the periphery of the wound, I mean, obviously, you know, and I think in most chiropractic offices, we're not going to see wounds, but any type of acute or chronic muscle pain, it's going to work fantastic on. I mean, I can't tell you how many times a hot back has come in and it's like, I wished I had a laser to calm this thing down. And again, using all three wavelengths in conjunction with on the spot certainly made manipulating or mobilizing the area much easier.
Okay, speaking of wounds, I do have a question that came in about wounds. Can the laser be used on an open wound?
Yes, but you wouldn't run it over the open wound. So what they do in conditions for wound care, there's a barrier placed over the wound. And what we're doing is going around the periphery of the wound, stimulating granulating tissue. So you're not going on the open wound, but around the periphery, and that's making sure there's a barrier over the open wound.
Okay, how deep can high power lasers penetrate?
Optimal 5 to 6 centimeters.
Okay. All right, great. So we're running a little short on time here, so I'll do one or two more questions. Is
sure.
high power laser better or more efficient than ultrasound?
Well, again, they're two different therapies, and here's what I'm going to say. For deep capsular tissue, fibrotic tissue, I think still ultrasound has its place. But aside from deep fibrotic capsular tissue, a laser's a better all-around choice.
Okay, thank you so much for that wonderful discussion, Dr. Farley Brown. Thank you again for joining us.
My pleasure, my pleasure. And if there's more questions, you know, time related, Regina, they can certainly email questions in to Zimmer that will get to me.
Yes, we'll provide that information.
Thank you.
of the webinar. Thanks again, Dr. Brown. That was a really informative presentation. If anyone would like more information about the OptonPro, please visit Zimmer MedizinSystems website at www.zimmerusa.com. You can access more information about the device using the website's main navigation menu. And Zimmer MedizinSystems also has an assortment of waiting room materials available for you to browse on the shopping site at shop.zimmerusa.com. And if you'd like to speak with Dr. Brown directly, please send an email to info@zimmerusa.com, and Zimmer can forward your inquiries and connect you with him. This concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review this information at your leisure. Good night.